Alright, here's your recording for the explanation of the blueprint in case you still need it. Just a reminder, questions will be always on the nursing process, and you know the steps, so the questions will always be along these lines. Okay, so the question will always be based on either the assessment, which is nursing diagnoses, which is the signs and symptoms, diagnosis. May not be nursing diagnosis, but it could be on diagnostic testing, which is nursing responsibilities. Implementation obviously are nursing actions, and nursing actions include pharmacologic, and then we have surgical management. So there are surgical, again, is post-op. Pharmacologic, these are nursing responsibilities, and teaching, especially with how to handle side effects or what side effects to expect. Evaluation and assessment are similar. The only difference is assessment is before interventions are done. Evaluation is the assessment after implementation. So this would cover questions on determining whether or not the action worked, or evaluating a teaching, for instance, whether or not the teaching was effective or the patient needs further education. I know it's better said than done. However, between now and Tuesday, you do have to manage your time properly. Don't just stay with the textbook. Yes, it's good to read the textbook because you need content, but please don't ignore practice questions. Remember, testing is a skill. You want to practice before the exam. Do not practice during the exam. That will already be the test obviously is graded, then it has an impact on your score. So testing again is where your opportunity, practice testing, is the opportunity for you to find out what you don't know about the topic. You don't want to find out after the exam. So resources will be Kaplan. You guys actually have, for those who I've already talking to, good. For those who are still unaware, we have the school has given you access to Kaplan since your second semester. You may not have been aware, but you do. No, wrong, sorry. Alright, so what you do is go to your Kaplan web page, which is, you just type test.com. If you're a student, then you log in here. Use the email that you're using for St. Paul's. That's the email we sent to Kaplan to create your account. If you've never logged into Kaplan, just hit again, the email you use for school is your username. then hit forgot password if this is the first time you're logging in. Once you do that, you'll get a automated email to reset your password. It usually goes to your spam folder, so please check that. Once you're in, this is now your home page. So go to your study plan. I don't know why this is okay. Alright, so once you click into your study plan, you'll have this tab, and then this is the tab where I want you to look inside the channel. So this is the Kaplan channel. They are a list of videos. We have videos by topic. They are arranged by system on your left hand side. So these are short 10 to 15 minute videos on the topic. So let's say cardiology. If you click that, here are the topics. They have heart failure, shock. So just watch which one applies to your current level. What I want you to see is the test taking tips here. If you click that box, you'll see live sessions. This one won't be useful to you anymore because these are later. But you always have access to recorded sessions. So on the recorded, you have archived sessions. There's always 4. So they are select all that apply strategies, how to eliminate choices, prioritization questions, test taking strategies. So get what you can from the speaker, use the techniques that they are suggesting, and these videos aren't very long. These are from live webinars which they recorded. They're about 50 minutes maximum, sometimes a little over, but my point is use the techniques that they're suggesting here, and of course it takes time for you to be familiar with the techniques, so use that as you're doing your practice when you're doing say your Saunders questions. Okay, let's go to your blueprint now. Post-op chapters are 14, 15, and 16. So line number 6, this is the topic. Please take note that these are the topics of the questions. I did not tell you whether it's an assessment, intervention, evaluation step in the nursing process. So you have to know all steps. Okay, I mean all aspects of the dressing change protocol. So that would mean, when would you change the dressing? What is the rule between first dressing change versus subsequent dressings, right? And how do you do it? What are your nursing responsibilities regarding that? Chapter 15, management of malignant hypothermia. This is when it says management, it didn't specify what about malignant hypothermia. So therefore this will cover risk factors, meaning what can trigger it. This might also cover signs and symptoms, and this is an emergency, so we look at the earliest indicators, who sees it first, and versus late signs, and then you go into interventions. It may include prioritization questions on what do you do first, or it could be a select all that apply, regarding management, or it could be all assessment also. Okay, so use the same way of studying. So you cover the nursing process questions. So try to answer these questions right here. So on each topic, make sure you can answer the steps of the nursing process on each topic. Consent is under chapter 14. This is regarding what is the nurse's role regarding consent. Are you the one explaining consent? Are you the one obtaining informed consent? Or are you what does it mean when you ask for the patient's signature? Or describe what is your role and most especially your responsibilities regarding consent. Next is prioritizing post-op complications to report. So this is prioritization, and post-op complications are listed by system. So again, your rules for priority is either ABC. You can also Maslow it. If Maslow doesn't work, use acute versus chronic, stable versus unstable, expected versus unexpected. Same goes for vital signs changes post-op. This obviously is under cardiovascular because that's vital signs. Recognizing post-op complications. This is again based on the by system. By the way, when I made the blueprint, this is based on the test questions. So if you see redundant topics, if you see redundant topics, that means there's 2 questions on that topic. However, if you look at the list, this doesn't total 75. Oh yeah, it does. Okay, never mind. So there's 80. Wait a minute. It starts at 76, so minus 5. This is minus 5. Yeah, so 1, 2, 3, 4, 5, 77. So yeah, so this is about 75 items here. So these are taken straight from the test questions on the final exam when I made the blueprint. So again, you don't know what aspect of the topic, what aspect of the nursing process the exam question is about, but at least you know the topic on how to study. So when I made the topic, that means you have to know that topic in order to answer the test question. Sequence of drainage, incision drainage characteristics, from sanguineous to sear-sang and serous drainage. What are expected and unexpected. I believe the post-op chapter did a good job describing that and gave you examples. Drainage device. These are wound drainage devices. We only discussed 3: JP, Hemovac, and Penrose drains. Core measures for skip. Chapter 14. This is covering prophylactic antibiotics, DVT prevention, UTI prevention regarding Foley, etc. And that's it for the peri-op chapter. On the diabetes chapter, this is specifically saying application. So onset is the basis for you to when to administer the insulin in relation to a meal, specifically for short and fast and fast acting insulin. Obviously, you don't need to account for the meals for NPH and intermediate and long-lasting insulin, because they're not necessary. So the onset is really significant for your short and fast-acting insulin. Peak is when this is obviously the highest time of highest drug action. So in the case of insulin, this is when the patient will likely experience hypoglycemia. And duration, this would be specifically for fast and short acting insulin when you can safely give another dose. Insulin storage instructions, both for insulin in use and insulin not in use. Oral antidiabetics, this is the chart for type 2 diabetes treatment from sulfonylureas down. It's referring to the nursing responsibilities, so this is on the second column of that chart. Acute versus chronic complications of diabetes, prevention and management. We only talked about one acute complication, which is hypoglycemia. Chronic complications, though, we had several, from macrovascular complications to microvascular complications. So make sure you know prevention and management for each. For all of them, it's a given that you try to keep the patient's blood sugar in normal range as often as possible. Diagnostic tests for diabetes, this is regarding the 4 tests used as a basis for diagnosis and interpretation. Similar to the question you already saw on exam 2, this is just a different question. Instructions for mixing insulin in 1 syringe. You also had a question like that on exam 2. Insulin administration instructions. So how do you teach the patient on how to administer insulin? So there's also a chart for you to review on that, on administration. Subcutaneous administration. Hypoglycemia management at home and at the hospital. So again, you had a chart on that, best practice, as well as teaching the patient and the caregiver. Next line is the 2 insulin complications, Somogy and Dawn phenomena. Recognizing and managing. So how do you diagnose each? Because both will have morning hyperglycemia. So therefore, how do you tell them apart? And how do you manage each one? Exercise guidelines and teaching. This is on what you tell the patient on the effects of exercise and what are the general rules to follow. Diabetic foot care, same foot care used under peripheral artery disease, diabetes, and also in cancer under peripheral neuropathy in cancer. Distinguishing type 1 versus type 2, risk factors, signs and symptoms, pathophysiology, and management. There are differences, so make sure you know. Again, I did not specify what steps of the nursing process this is. This could cover signs and symptoms, or it could cover management or interventions. Managing diabetic clients who are NPO. Please read that section on how to manage a diabetic patient while they are NPO in the hospital. Then we have that means there's 2 questions on this topic because it's been mentioned more than once already. Insulin management, this is the same as line number 14, onset, peak, and duration. and another here. Which diabetic client to see first? I think there was one earlier, or maybe not. And then an evaluation question. How do you know whether or not the patient is managing their diabetes well or not? Blood glucose management, specifically hypoglycemia. This could be prevention, okay? Although I didn't specify that, so I don't remember exactly. But there are only two possible questions here: either prevention or management of hypoglycemia. This is a duplicate, so therefore there are two questions, at least two questions, on the oral hypoglycemic drugs and insulin as well. Then we have teaching for diabetes, both types, and then comparing hypo from hyperglycemia. That's the end for diabetes. Let's go now to oxygenation. Only one question on chapter 29 under epistaxis, at least. So just one question: how to manage nosebleed, emergency care for nosebleeding. Next is for sleep apnea. Topic is specifically for how to use the BiPAP CPAP, what could be complications, and how you prevent them. This one is now sleep apnea causes, signs and symptoms, how to diagnose it, because that's testing, which is obviously the sleep study. Interventions is eliminating the causes if you can, and then complications of sleep apnea, which not only covers the cardiovascular effects but also safety and your client teaching regarding that. We will eliminate this one because we didn't have time to cover that. MDI versus DPI. So this is the inhalers, the wet and the dry powder inhalers, instructions on how to do it. Drug therapy for COPD, side effects and teaching. So typical drug question. Just a reminder, the drugs are under asthma because they're the same for asthma and COPD. Breathing exercises, namely pursed lip, diaphragmatic exercise or abdominal breathing. Nutrition teaching, how many calories, what it should be made of, what to do to improve nutrition in COPD patients. Suctioning, this one is specifically on nasotracheal and nasopharyngeal suctioning. I believe that is in chapter 28 under oxygen therapy. For TB, the 4 anti-TB drugs: INH, Refam, ethambutol, and pyrazinamide. Regarding regimen, I only discussed regimen 1, which is the treatment for new diagnosis of acute pulmonary TB. Side effects of the drugs and client teaching. PPD results. This is based on CDC. I sent you the links already in a previous email. TB, when we say TB, of course, only active TB patients have signs and symptoms. Precautions obviously is airborne. That would include you're expected to know what should you prepare, or what would you observe in an airborne isolation order. Testing, which is covering PPD already. but we do have other tests, especially if the patient had a history of receiving the BCG. Communicability, meaning when is the patient contagious, or it could also be when is the patient no longer contagious. Teaching regarding that, and how do you know if the treatment is working? So that's evaluating response to treatment. Next is pneumonia. Types from community acquired to the healthcare associated pneumonia. Causes for each, signs and symptoms, how do you prevent it. There is a chart on preventing pneumonia. And of course that will include vaccination, but I do have vaccination separately here, line 47. And treatment for pneumonia, just the standard treatment for both community acquired and hospital acquired or healthcare associated, sorry. ABG interpretation. So this is only one question. This does include whether or not there is compensation. Pneumonia vaccination, we practice this from the link I sent you from CDC. Please make sure you answer that. I can tell you from memory, this is definitely a select all let apply question. So that covers adults only, so 65 years and older, and also patients age 19 to 64 with certain medical conditions. Please include all those details. COPD types, so we have emphysema and chronic bronchitis. Signs and symptoms for each, causes, how they developed, and treatment. Treatment were already mentioned here in line 39, so I guess that's two different questions. Expected versus unexpected, or signs and symptoms of exacerbation in COPD. Make sure you're able to distinguish between the two. Oxygen therapy for COPD patients. So this is where we had a debate whether or not to give oxygen and how we give oxygen to patients with COPD. Cancer now is next. So we started with chapter 21, distinguishing between benign and malignant tumors. And also make sure you understand metastasis, because it says explain the concept, so that means it could be the nurse explaining metastasis to a patient. So that would also include primary versus secondary tumors, the difference between the two. And then causes of cancer, so we have physical, internal, and external carcinogens, the caution acronym, and classification, which is staging of tumors using the TNM classification. So it says here interpretation, so make sure you know what so let's say T2N1M0 means. Okay. Okay, diagnostic test for cancer, tumor markers, and client teaching. So we're talking about biopsies, the oncogenes, cancer prevention, including cancer screening guidelines from cancer.org. I showed you how to get to it from the ACS website. These are line 55 is specific examples of primary and secondary cancer preventions. Surgical management of cancer, Remember, there were different purposes of surgery, namely prophylactic, diagnostic, curative, restorative, palliative, and side effects of surgery, which again is specific to to the organ, to the non-vital organ that we removed, or body part. Radiation. So this is internal radiation because it's saying sealed versus unsealed. Um, Chapter 63, which I didn't get to in class. Let me show you. In chapter 22, the example given in the textbook for internal radiation was specifically on sealed radiation. 63 is the unsealed radiation. I'll show you the specific page number. Alright, so again, the the chart shown in chapter 22 was for a sealed radiation. If you remember, for a sealed radiation, the patient is radioactive because the radiation source is inside the patient's body. However, since they are sealed, they therefore do not enter body fluids. So the anything wet coming out of the patient isn't radioactive. Well, chart 63-4 on page 1268. This one is an example of unsealed radiation. So this is under hyperthyroidism, and hyperthyroidism is treated with an unsealed radioactive isotope. So this is either ingested by mouth or injected IV. So these are now your precautions, since the patient's body fluids are now radioactive. So that's why you have body fluid precautions now. Specifically for the distance, if you compare this in chapter 22, in chapter 22 we were able to stand 6 feet away from the patient and stay 30 minutes only. But here, this is now unsealed radiation, so now we can stay closer to the patient and we can stay a little bit longer, so half the distance and double the time, if that makes sense. All right, let's go back. Acute and late effects of radiation. This is obviously external beam radiation or teletherapy, and followed by skincare after radiation. What to do with the ink markings, how to care for the patient, what you can safely apply on the patient's skin, what protection you need to observe, especially when with regards to sun exposure. Chemo drugs. I'd like to emphasize again, the questions won't be about the chemo drugs, so there's no need to look up a drug book and see what the side effects are. Chemo drug is a chemo drug. They will cause the following side effects, which is on line 61. They will cause pancytopenia, namely anemia, thrombocytopenia, and neutropenia. They can cause mucositis. They can cause nausea, vomiting, alopecia, and peripheral neuropathy. However, I showed you a caption on the book saying um, care for a patient receiving chemotherapy is the responsibility of all nurses. So, even though you are not the one administering the chemo drug, you are taking care of a patient who is receiving it. So I told you in class you need to review signs and symptoms of extravasation, which is your most serious complication during infusion. And that takes us also to because most patients receive it via central line, and I told you to read table 13-3, which is where your exacerbation signs and symptoms and nursing responsibilities are, or nursing actions are. Next, these are the drugs that we administer in order to increase red blood cells, white blood cells, and platelets. But your book only mentioned side effects for epoetin and pelvican, so these are the side effects for these two will only be the ones testable. Filgrastim wasn't mentioned, so I can't test it. Oncologic emergencies, we had 6, but I told you we will, because sepsis and DIC is in another chapter, specifically chapter 37 under shock. So I'm only testing the other 5. Questions again will be on signs and symptoms, meaning how do you recognize the emergency? How do you know that it's present? So that's testing. And then finally your interventions and ways also on how to prevent them. That's it for cancer. Next, fluid and electrolytes. 2 questions. Well, minimum 2 questions. Because it could be in any of these electrolyte imbalances. So they are potassium, sodium, and calcium. That's signs and symptoms and interventions. Okay, some of them may be in relation to the oncologic emergency because we did have hyperkalemia in as an oncologic emergency, as well as a hypercalcemia, okay, in oncologic emergency. Next question is on dehydration versus fluid overload. How do you identify them, and what are your diagnostic tests that show you, or diagnostic test findings? Then finally interventions. That's it for F&E. Next is they're all under the heart now. In chapter 33 and 35 we discussed heart failure classification, and if you remember, my suggestion was only to remember class 2, 3, and 4, because class 1 really the patient has heart disease but they are comfortable at rest and there were no major problems with ADLs. They were still able to do them. We did have this question already on exam 2, the size for the blood pressure cuff, so you have a question, a similar question on that. I think this time it may be the effect of using the wrong size. Okay, so you can still get that answer from your Potter and Perry, same as with in exam 2. Recognizing left versus right side heart failure, including lab findings and your interventions for each. Interventions will be, of course, your doable acronym. Those are the drugs. And teaching also. And specifically for digoxin and recognizing DIG toxicity and nursing responsibilities. Effects of the cardiac compensatory mechanisms on the patient. So we discussed these in chapter 33, plus also a little bit on chapter 11. These are specifically the sympathetic nervous system response. How does that affect a patient in heart failure? At the same time, also the renin-angiotensin aldosterone system. So those are the two major compensatory mechanisms. But I believe chapter 33 also mentioned about the BNP, B-type natriuretic peptides, because that was also part of the compensatory mechanism. And finally, the last one was on antidiuretic hormone. Next, the side effects of the doables acronym drug therapy on heart failure. And next are infectious or inflammatory cardiac disorders. So beginning with risk factors, signs and symptoms, management, including drug treatment and complications of the following: endocarditis, pericarditis, and rheumatic carditis. Risk factors, so that means there's two questions there because that's the same thing. I have two questions on the valve disorders. This one is recognizing signs and symptoms. For your book only mentioned and discussed mitral valves and aortic valves, I believe. And your management after a patient undergoes either valve repair or replacement. So that's valvuloplasty. On chapter 36, PAD and DVT, risk factors, prevention, signs and symptoms, diagnostic testing. So we have here another question on ABI, nursing interventions, and drug treatment for both. Remember, DVT drug treatment is anticoagulation, which is on the next line. So if a patient is receiving heparin and or warfarin, which are our most commonly used anticoagulants, so how do you manage it? How are they given? Why? And signs and symptoms to report. So obviously those are the side effects of anticoagulation, which is bleeding. Next line is these patients aren't kept on the hospital, so they're discharged home with anticoagulants, so you need to teach them. Teaching includes herbal supplements because some of them interact with anticoagulants, namely St. John's wort, ginkgo, and the rest mentioned in your textbook. For arterial, venous, or diabetic ulcers, differentiation, again, that is the big table comparing their pathophysiology, their appearance, the wound bed, location, and the management. I don't believe we got to Buerger's versus Raynaud's disease, so I guess I will remove that as well. And then finally, you have 5 math questions, easiest 5 maths you've ever taken. And that's it. Good luck, everybody.